A brand new program is being introduced at the Texas Tech University Health Sciences Center in Odessa. And if you are expecting a little one soon, this program is just for you. So here to tell us more about the centering program is Dr. David Banh. He's an OBGYN with the Texas Tech Physicians of the Permian Basin. So thank you so much for being on with us.
Oh, my pleasure to be here.
Absolutely, for sure. So talk to us about centering pregnancy. What exactly is it?
Well, centering pregnancy is basically a different form of providing prenatal care to new and expecting mothers. And how it's different is that traditionally you would go to see an obstetrician and they would provide you one-on-one care. And in centering pregnancy, that care is actually transitioned into a group setting. And so the patients or expecting mothers would actually share this experience with other mothers of the same gestational age. In that essence, most of them feel like they have more of a bonding experience, more support, and certainly they can get more information from their providers as well.
Sure.
In a traditional setting, usually, you probably see an obstetrician for about 15 minutes or less. Here, because you also get your standard prenatal care, also the group discussion, this can usually take up to an hour and a half or 2 hours for most people, and they truly appreciate this kind of experience because they.
And I bet that extra time really just helps that patient know that we are here to care for you, and just instead of 15 minutes and you get that hour and a half time, which is great. What are the other benefits of centering pregnancy?
So the biggest benefits that has been shown is that there's a reduction in preterm birth, and obviously that preterm birth is a real big deal, especially when you think about March of Dimes and their strong support for a reduction of preterm birth, and they also provide a lot of support to centering pregnancy as well. Other things that we hope to see as a benefit to patients who come to our program is also breastfeeding continuation. Most places are trying to get new expecting mothers to initiate breastfeeding and continue that for at least 6 months after they deliver.
Okay. Now, how can expecting mothers sign up for this program?
They should certainly call our clinic, Texas Tech Physicians in Odessa here, and that information can be looked up, I guess.
Yeah.
We can provide it. And if they're expecting, certainly just basically scheduling any regular OB visit with any of our providers, and they will provide more information on how to get into the program.
Okay. Now, how can the community get involved if there is a way that they can help get all of this on track?
Yeah, and one of the biggest things is I would love the community to get involved, because this isn't just about new moms being there by themselves. We're creating a support group, a social environment that they can thrive in, and the community can certainly help some of these new mothers, by just calling us, and we can certainly set up some kind of arrangement that allows them to assist us with certain programs. For example, we would, breastfeeding. So they can just certainly help us, and we can, arrange that for them.
Good deal. Well, thank you so much for being on with us today, giving us that great information.
Yeah, thank you.
Absolutely. All right, stick with us. We'll be right back.